Good morning, everybody. So thank you for that wonderful introduction. I just want to echo Patty's encouragement for you to fill out the pre-training survey. That really helps us to know how things worked today. Today's webinar is titled Suicide Prevention During the COVID-19 Pandemic. And we'll be joined, in addition to myself, we'll be joined briefly towards the end of the webinar by Meg O'Lien, who's the Suicide Prevention Manager at Santa Clara Behavioral Health, who's going to tell us about some suicide prevention resources. So today we're going to be doing a few things. We're going to be working together to learn the warning signs of suicide, so that as helpers and as friends, we can notice when a loved one may be feeling suicidal. We'll also learn the be sensitive and be brave approach, which is an approach that we can all use to support someone in suicidal distress and encourage them to get the help that they need. Also, we'll have some take-home exercises and resources that you can use to practice how to talk about suicide and learn what resources are available when people need help. So first, a few things. I'd like to just give you a few pieces of information about today's training. The training is tailored for community members and gatekeepers, covering some foundational skills for suicide prevention. And that doesn't replace a more comprehensive suicide training for mental health providers and clinicians. We've certainly welcomed providers and clinicians today, but there are things about kind of suicide management on the clinical side that aren't going to be covered today. Also, some of you may be outside of the Bay Area. Much of the material in this webinar will absolutely be applicable for you. Since the majority of us are in the Bay Area, we'll be showing some local suicide statistics from Santa Clara. Before we start, I'd like to recognize together that suicide can be a pretty difficult topic to talk about. And this might be the first time you've really discussed suicide, or you may be all too familiar with it. Either way, I just encourage you to be as open as possible to learning today while prioritizing your own care as well. Some of the material today may be triggering for some of you. And if that's the case, please be kind to yourselves. Please take breaks when you need it. We will be recording the webinar and making it available at the end, so you can always come back to it. Okay, so here's an overview of our webinar today. We're going to start by learning some basic definitions and statistics about suicide, including COVID-19 specific information, along with some common ideas and misunderstandings. So after laying this groundwork, we're going to build skills that we need to be helpers for our families and friends and community members who may be experiencing suicidal distress. We'll learn to identify warning signs, including cultural and COVID-specific warning signs. And by using the Be Sensitive, Be Brave approach, we'll practice how to ask about suicide and hopefully connect people with the help that they need during the COVID-19 pandemic. And throughout the workshop, we'll be also learning how to think about the role of culture and diversity when helping around issues of suicide. So if there's one message that I'd like to convey today during the COVID-19 pandemic, it's that more community eyes and ears are needed at this point. So please reach out to people that you don't usually reach out to, and reach out to them more and more often. And I'm gonna really emphasize this point a few times today. So why don't we begin with some definitions? There are certainly many different ways that people talk about suicide. So on this slide, we provide a few definitions for some of the most common suicide terms. So if you look at your worksheet, your take-home worksheet that you should have received in your email reminder with the Zoom information, if you look at page 1, feel free to fill in the blank on your worksheet to help solidify that knowledge. So if you know the language, you'll be much more prepared to support your friend or your loved one and to advocate for them with professional help. So this first one is suicidal ideation, which are thoughts about killing oneself, thinking positively about death, or thinking about actions that could lead to death. The second one here is suicide attempts. So these are non-fatal self-directed acts intended to end one's life. So these are attempts that don't end in a suicide death. And then for the last term, you may have heard people use the term commit suicide, which is really more recently seen as potentially invalidating because of its relationship to the idea of committing a crime. So really together, what we're trying to do is just change the terminology that we're using. Die by suicide is the preferred term that we want to work together to use more as a more supportive alternative. So a suicide death is a self-directed act that results in someone ending their own life. Now, suicide nationwide has been a growing problem with rates that have risen in the past 15 to 20 years by a lot. Some of the CDC data suggests a 33% increase in rates from 1999 to 2017. And some folks have started to think about it as a national public health crisis. Now, here's an example from Santa Clara County that just illustrates how a community-wide suicide prevention effort can potentially have positive results on saving lives from suicide. So Santa Clara County has a suicide prevention program that it's among the more developed and community-wide within the state of California. And amidst these types of efforts that they've done, including many, many trainings like these within the community, the good news is that even though suicide rates have been going up in the U.S. overall over the past 15 years, suicide deaths in Santa Clara have looked relatively stable. And we think that this perhaps emphasizes this idea that preventing deaths by suicide in our community is really a collective effort, and each of us does have the potential to make a big difference as community helpers. Now, when we look at the data to understand differences in suicidality between different demographic groups, we start to see that diversity and cultural differences may make a meaningful difference. So cultural identities, and I just want to say that cultural identities, I use that term to include more than just race or ethnicity. It also includes age, sexual orientation, gender identity, and other identities. So here we see that some of our highest nationwide rates of suicide are in middle age and in older adults 75 and 85 years and older, particularly men. And I just want to note that these rates may be particularly meaningful during COVID-19, as we see that older adults are both in one of the highest risk groups for both contracting COVID-19 and having the effects of COVID-19. Sorry, not contracting, for having severe effects of COVID-19 and for high risk for suicide. And middle-aged adults are at the highest risk for suicide and potentially for financial impacts if their jobs are lost during social distancing. So these kind of risk statistics are something important for us to keep in mind. And also, the rates are highest in older adults and middle age of suicide deaths. Youth may actually be particularly at high risk for suicide attempts, as shown by these high rates of visits to the ER by 15 to 24-year-olds in Santa Clara County. We also know that there are important cultural factors and subgroups that are related to heightened risk in the US overall. So I list a few of them here. Older adult Asian American woman, if you look at nationwide data, pretty consistently for women over the age of 65 and particularly above 85, Asian American women have actually the highest rates of suicide deaths. And the research tends to suggest that the trends of suicide risk as people immigrate to the US, they mirror the country that they came from. So when you look at the international rates of suicide, the box in the middle here with individuals from South Korea, China, Japan, and India, those countries are listed in order of highest suicide rates in the world, with South Korea as number 1, China number 2, Japan, and then India. And then in the US, American Indian and Alaska Native groups show some of the highest rates of suicide. In the military, as many as 20 suicide deaths per day or more. And LGBTQ plus populations are at particularly high risk for suicidal ideation and attempts, with some recent data just in the past 5 or 10 years showing that transgender individuals have some of the highest rates of attempts that we've ever seen compared to anybody else. Anywhere from 40 to 80% of transgender individuals having attempted suicide at some time in their life. So we really want to be aware of cultural groups at elevated risk and cultural risk factors. In Santa Clara County, this is a pretty complicated graph, but I just want to draw your eyes to these numbers. So there's 44.94 here. It turns out that in Santa Clara County, the highest rates are amongst Pacific Islander groups, which is a very small population in Santa Clara, but it's still they're dying by pretty high rates, and Native American individuals followed by whites. So some of the larger nationwide data, for example, doesn't parse out Pacific Islanders. So if you don't look a little more closely, then you'll miss them. So let's address this question, which is, will suicide rise during COVID-19 and during social distancing? So many assume that death rates by suicide across the nation will go up because of the stresses related to COVID and social distancing. However, we certainly don't want to spread false information. And it's important to realize that we don't know definitively that this will be the case. So in fact, at the population level, it could really go either way. So if you look historically in economically difficult times, such as the Great Depression, suicide rates rose, though surprisingly in the Great Recession of 2007 to 2009, that didn't look like there were actually a greater number of suicides. And during other national crises or disasters, like World War II, suicide rates actually fell and went down. And one of the theories one of the predominant theories and thoughts about why that is the case is that in national disasters and situations, when communities unite together around a common cause, those increased connections can actually buffer the effects of suicide. And maybe that's why we actually see suicide rates fall in some national crises. So thus, the importance of us all being here today to learn how to be the eyes and ears in our community. I feel so heartened that so many folks in our community, both locally and nationwide, have joined us today. Almost 500 folks are together today. And if you think about the impact that we can make as almost 500 people committed to taking an hour and a half of your time to learn about this, to be the eyes and ears in our community, it's so important. So I hope that COVID-19 actually can be kind of a situation where we actually come together and prevent heightened suicide rates. So though we don't definitively know whether rates will rise during COVID, as these example newslines and headlines show, there are certainly individual cases of suicide death that are starting to occur with potential connections to the stresses of social isolation and unemployment. And also based on what we know about triggers for suicidal thoughts, social distancing and COVID-19 certainly puts the population at greater risk for suicide-related distress, as represented by this tweet shown here. So it is certainly a time for us to mobilize together. In addition, we do know that recent crises and health problems, which may be relevant during COVID-19, can also trigger suicide. So among those who died by suicide in 2016, for example, the CDC found that nearly a third had experienced a crisis during the previous 2 weeks or expected to experience one in the upcoming 2 weeks. And about a quarter were dealing with a physical health problem. So those top two bars may be relevant in COVID-19. The Kaiser Family Foundation also released recent data from their nationwide community surveys. They do a health poll pretty regularly. And they showed that as social distancing has increased across the nation from early March, which is the top bar, to late March, the bottom bar, if you look at the darker blue bars sections, you'll see that more adults are reporting minor or major impacts on their mental health. So we know that the risk for suicide may be increasing because mental health is a huge risk factor for suicide risk. The mental health impacts of COVID-19 may also be differentially impacting some segments of the population. So for example, that same poll by the Kaiser Family Foundation showed that the major negative mental health impacts, put your eyes towards the dark blue bars, the major negative health impacts may be differentially larger for women and for African American and Latinx individuals as compared to the total population up top. So you're seeing in terms of major impacts on mental health, 24% for the Black and Hispanic group, compared to 19 for the total population. So this is just something to be aware of as we reach out to support our communities. And also just consistent with this idea about negative mental health impacts of COVID and social distancing, local data in some parts of Northern California show increased use of crisis lines with help topics just more and more related to the pandemic's effects. So for example, the use of crisis support services in Alameda County has almost doubled from 100 calls per day to 200 per day last week. The Santa Clara County Crisis Line has reported having calls with topics related to COVID-19 related concerns. And also in Santa Clara, the county's Crisis Text Line, which I put the resource here on the right and will tell you about a little more later. They've actually seen a 400 to 500% increase in their number of text conversations. So about 171 from March alone compared to 20 to 40 in a typical month. And also the number of suicide de-escalations through the crisis text line has also increased. The number of de-escalation, oh my gosh, I can't say that word, de-escalations from the past 1.5 months is greater than the number from the entire past year. And when people are using the text line, it looks like they're mentioning the top three main issues are anxiety and stress as number one, followed by relationship problems, which I'll talk about in a bit, and depression and sadness. So all of these concerns are reasons, again, why more community eyes and ears are needed. So that's you, all of you, and me. We are the community eyes and ears. So thank you for coming again today. So now that we've reviewed some of the information about suicide statistics and COVID-19 related social distancing related statistics, now let's review some common myths about suicide that you may have heard before. So again, if you are following along on your worksheets, you can turn to page 1 and follow along with your ideas about which of these written statements might be myths versus reality. Okay, so this is the first one. If I ask someone about suicide, then they'll do it. This statement refers, and please feel free to use the chat box to share your answer, myth or fact. So this statement refers to the idea that if you ask someone about suicide who's in distress, but hasn't previously thought about it, you could actually be putting new ideas in their heads. So therefore, maybe we shouldn't try to ask. All right, it looks like folks, for the most part, got it right. This one's a myth. Nice work. So in reality, you're not going to make anyone suicidal by asking them about suicide. Instead, talking about suicide actually makes it more visible and helps people know that you're just someone who acknowledges it and wants to help. So in fact, people have done research about this and they've investigated this question. And the research shows that just simply the act of asking about suicide does not make them suicidal. So it actually makes them more heard. All right, the second one. All suicidal ideation is not the same. What does everyone think? Myth or fact? All right, everybody's putting fact in the chat box, and absolutely, this one is a fact. So what we know is actually there's a big difference between active suicidal ideation and passive suicidal ideation. And on the bottom of this slide, I've put a couple of examples. So an example of active suicidal ideation is I am thinking about killing myself. An example of passive is, I wonder what would be different if I was not here. Or if a meteor happened to hit my car on the drive home, I would be okay with that. And so although we should always be concerned about someone who's thinking about suicide or who expresses suicide, and we're going to be much more concerned about someone who's thinking about ways to end their life with the active ideation as compared to someone who's thinking about dying more generally. Also, it's useful and important to know that ethnic minority groups may be more likely to hide their active suicidal ideation when we ask them about it. And so sometimes you might need to be a little more persistent or ask about it in different ways. And the thought is that one of the reasons for that is just concerns about stigma or hesitancies or fears about the mental health system. All right, and then the last one here, you can't stop someone who wants to die by suicide. That's a common thought that I've seen float around quite a bit. All right, and quite a few are you saying myth, absolutely. So what we know is actually that suicide is one of the most preventable forms of death. Although we can't control anyone else's life completely, if we help them through a suicide crisis, we can keep them safe and help prevent them from ending their life. And we do know that oftentimes, that impulse to die by suicide can be fleeting. So even the simple act, sometimes it's not so simple, but the act of putting distance between them and their method of suicide. So for example, if you lock up their gun, or you separate the bullets, the time that it takes them to get access to their means of suicide, you can actually have the impulse can dissipate and go away. They can get through that crisis and you can effectively prevent the suicide. And we call that means restriction in the field. And means restriction is an effective way of saving lives. Okay, so again, if you want to have access to those myths, those are on your worksheets. We're now going to talk about some common warning signs for suicide so that you can be those eyes and ears in the community. So on page 2 of your worksheet, you'll have this list, which I also put up on this slide. Is a list of common warning signs for suicide. So what you'll see is that there are some general ones and some also very specific signs of suicide risk, and they can be thought of in different categories that I've labeled on the black bars. So when your friends or loved ones are feeling suicidal, you might see thoughts, you might see feelings, physical signs, behaviors, verbal statements, and red flag situations. So 6 main categories. So for example, general physical pain, as well as emotional pain or mood changes can be a sign of suicide. And at the same time, specific thoughts like thinking others are better off without you can be signs of suicide. Feeling hopelessness is very highly related to suicide, and we know that by the research, as is giving away prized possessions. This in particular is a concerning sign that someone may be making preparations for a suicide attempt. We also know that certain situations are linked with increasing suicide risk listed on the right here. So it can be really useful as helpers to know that some of these common warning signs for suicide, what they are, it's just important to know so we can look out for when our loved ones may be in trouble. So what you'll see from this list of suicide warning signs is that social distancing in the COVID-19 pandemic have the potential to actually trigger quite a few of them. What I'm going to do is I'm going to highlight the warning signs that may be triggered by COVID-19 here in green, and I'll comment on some of these, and then we'll come back to this list to familiarize ourselves a bit more. So when I went through our kind of typical warning signs, you'll see that more than half of them could be triggered from the situation that our nation is struggling with right now. So again, I'll come back to this list in a bit. I'd like to talk about a few of them specifically. So during COVID-19, what we know from recent data, it's shown that about 39% of adults say that they've already lost their job, lost income, or had their hours reduced without pay because of the recent coronavirus outbreak. So these are really big financial stresses for a huge portion of our population. And I know in the news yesterday, the unemployment claims, new claims went up by a large number. And what you see here is that the economic impact from the coronavirus may be greater for some identity groups, including parents, the Latinx and Black communities as well. During COVID-19, Asian American communities have been experiencing more targeted harassment. Anything from my friend's daughter, I remember in early March, came home upset that our good friend's mother told her friend to stay away from Chinese kids like her at school, to lots of other stories that I've heard about hate crimes and discrimination. Just recently, A3PCon, along with San Francisco State University and Chinese for Affirmative Action, they started tracking how widespread Asian American discrimination has been because of COVID-19 through a website called Stop AAPI Hate. And this is the data from that effort. In their first 2 weeks, they received over 1,100 reports of physical assault, verbal harassment, and shunning, with verbal harassment being the most common example. And here are some examples from A3PCon's data collection of experienced discrimination by Asian Americans. So for example, I got pushed and slammed on the floor by my neighbor who lost his job. He yelled at me, "I lost my job because of Asians and Asian Americans. I got my back, neck, and hand hurt." What we do know is that incidents of discrimination like this have been linked in research to heightened suicide risk for marginalized communities and ethnic minorities. So this is something that we certainly need to support each other through. And then finally, I wanted to mention that during COVID-19, there's also the potential for more social conflict between people sheltering together. And this has been reflected through increased incidents of domestic violence. So for example, internationally, in some countries that have been on lockdown prior to the US, there have been reports of increases of up to 30% of domestic abuse reports on hotlines. So what we know is that during confinement, and hopefully, as people are spending more time together in partnerships or in families, that gives them time to actually bond a little bit more, but that doesn't always happen during confinement. Actually, IPV, which is the abbreviation for interpersonal violence, and also more psychological abuse can increase. Okay. One of my friends, for example, is just picked up the book called Another Friend with Young Kids. I have a couple young kids at home. They picked up the book that is called How to Not Lose Your Shit on Your Kids. So there's a little bit of humor there, but it is certainly a stressful time interpersonally for some folks. Okay, so now back to that list of warning signs. All right, you can see up here that individuals sick with COVID-19 or even people unable to get regular health care through physical health issues unrelated to COVID could be at increased risk. Emotional warning signs at the bottom left here are all potential feelings that someone may feel as they're sheltered in place without a sense of control of when things might return to normal, or as they deal with the loss of a job or unemployment. One of my friends who saw her hard-fought career in jeopardy have told me recently that she's, when I checked in on her, said she's generally doing fine other than her self-worth, which had a lot of impact on me. So I, of course, made sure that I'm going to be checking on her more often. So as people cope with being socially isolated, they're coping with more anxiety and depression, or anybody who has an existing serious mental illness or mild mental illness, they may be struggling more, and some folks may be actually turning to behavioral signs more, drugs, alcohol, letting on the bottom here, letting self-care go, or other withdrawal, spending more time alone. We do know from some of the data, it might be some of these struggles might be being reflected in some of the increases in pornography viewing. And then finally, in the situational warning signs column, we see that discrimination, financial distress, abuse, and social conflict, all of those situational stressors that we just discussed. So certainly some of these suicide warning signs, hopefully this illustrates to you how COVID-19 can be triggering suicide risk in our communities. Now, so though it's useful to know that the warning signs for suicide, what they are, it's also important to know that it's not a foregone conclusion that suicide risk will go up during COVID-19, like I said earlier when I was reviewing statistics. So just like life is a balancing act, suicide risk is a balancing act. So stresses can be additive. So, you know, for folks who are already dealing with a lot of stress, COVID-19 related stressors could be that last straw that makes someone suicidal. So those financial stresses, restricted social outings, discrimination, difficulty maintaining healthcare. If you have a lot piled on, then that could actually, you know, all of these COVID-19 stresses could tip the scales. However, stresses can also be outweighed by strengths in someone's life. So through this training, we really want to impress the point that a lot of these things over here on the right, loved ones checking in more often, scheduling more video chats, doing mindfulness meditation that you can do alone or in groups, using some of the time to do more exercise or doing more hobbies, practicing strong coping skills. These can outbalance some of those stressors on the left. And, you know, again, I really want to emphasize that more community eyes and ears are necessary at this point. And you can see how more community eyes and ears and support can really help on the right side. So let's really see if COVID-19 can be a cause around which we unite together as a community. You know, like I said, can we reach out to people you don't usually reach out to, even, you know, through whatever method is the most appropriate. And it's also important to recognize that not everyone will react to the pandemic the same way. The same stressor, for example, can mean different things to different people. And so as an example, one of the things that we know is that some of these suicide warning signs are more common in cultural minority groups or are related to specific cultural reasons for risk that are stronger risk factors for some more than others. So we call these in the field, we call them cultural variations in suicide warning signs. We call them cultural risk factors. So I've highlighted in yellow some of these cultural variations. For example, we know that when people are from more collectivistic families, where family defines who you are, when those individuals think others are better off without them, or if you hear somebody who's from a collectivistic cultural background say that they're feeling like a burden, those individuals are actually at increased risk for suicide compared to somebody from a non-collectivistic culture. And in addition, if someone who identifies as an immigrant has trouble adjusting to the US or a new culture, or an LGBTQ plus identifying individual experiences rejection from their family or discrimination, these events also put those people at risk for suicide. And particularly for some youth, these warning signs and situational risk factors may happen on social media, and that might happen more often during COVID-19 and social distancing as well. So just like the warning signs that vary because of what they mean to different cultural identity groups that I just kind of gave examples about, COVID-19 related warning signs can also affect people differently depending on the meaning that the stressor holds for them. So let me see if I can illustrate that a little bit. I invite you, when you're concerned about a friend or loved one during COVID-19 and you see some of those warning signs that we just reviewed, I invite you to ask yourself, what does the COVID-19 stressor mean to them? So in this illustration, for example, if someone has lost their job or they've lost income, that lost job may be outweighed by positive factors in their life, using that kind of balance beam that we talked about before. However, again, if you ask yourself this question, what does the COVID-19 related stressor mean to your friend or loved one? If that job loss on the left here has heavy meaning for their worth as a person, and I gave an example before when my friend said, you know, I'm doing okay except for my self-worth. The weight of that warning sign may be much heavier and harder to cope with for that person. So asking yourself that question can actually help you figure out when it might be particularly important to reach out to our friends and loved ones. Okay, so now just a check-in here about where we are in the training. So what we've just done in reviewing key steps as a helper is that we've reviewed suicide warning signs. And when we did that, we were really starting to practice these key steps in being a helper in preventing suicide. And we're now going to move on to the second step here, which is asking about suicide. So I'd first like to remind you that in reality, you're not going to make anyone suicidal by asking them about suicide. Remember when we covered that myth? So in fact, because suicide is not a topic that most people are used to talking about, it's likely that your loved one may not have people to talk about their suicide with. So, so you might be, you're being supportive by actually asking that question. However, it's also important to recognize that it's not easy to talk about suicide. It's not something that we are raised to ask in everyday conversation. And it is something that we get better at when we practice and follow a few simple steps. So first, let's cover some general guidelines. So the first general guideline is to stay calm. You are here to help, not act as a magician or a white knight or a fixer. Sometimes that pressure to be that magic fixer can actually make it more difficult to provide the support that your loved one might need. So we certainly want to hopefully try to relieve that pressure off of you. So whenever you ask someone about suicide, it should always happen in 2 steps. The first part is be sensitive, and the second part is be brave. Be sensitive and be brave. Recognize their humanity, have that human connection, part 1, and then ask the question very clearly and directly, part 2. So you'll hear me refer back to this phrase, be sensitive, be brave, a few more times today. And so I'm going to go through some examples and tell you about be sensitive, be brave. As we go through these examples in the following slides, you'll see there's a space on page 2 of your worksheets where you can write down some of your own examples for being sensitive and be brave. And hopefully that worksheet then can be a resource for you. All right, so the first step in asking about suicide is to find a way to connect with the person that you're with. We really want to use active listening to build a connection together, which can also give you the room to be able to see and learn about warning signs. So here are some examples of openers that I've listed on the slide. You're dealing with a lot right now. I know that a lot of people who are dealing with this kind of stress have dark thoughts. Okay, so as a way of showing that you care, showing empathy and connecting. I hear you right now and I'm worried about you. And then just skipping to the end here. You're not acting like your usual self and I'm worried, so let me ask. So any of these examples or any, this can also be kind of that connection, taking, this step can actually take quite a bit of time when you're just, reaching out and being supportive and listening. Active listening is sometimes the most important thing that you can do. It's also important to consider the person's cultural identity and their cultural preferences to connect with others during a hard time. So for example, my own grandfather, who's now passed, who I love very much, he barely said, 10 words. He was definitely the strong silent type. Folks like him and others may prefer to just sit in silence and to have that human connection by sitting in silence. You can sit in silence together over the phone or over video chat or with someone that you're sheltered with. Others may instead prefer to discuss their thoughts instead of discussing their feelings, as discussing feelings up front may feel a little bit too vulnerable, or that's just not what they're used to doing. So, so just kind of be sensitive to what your loved ones or your friends, your companions' preferences are for connecting. One tip that I've found to be helpful when you don't exactly know, what is their preference, is just to simply ask, it looks like you're going through a lot right now and I'd like to support you. How would you prefer me to support you? And that is just a really nice, simple way of respecting someone's preferences, their comfort, and their cultural identities. All right, so that's the first step, be sensitive. The second step in asking about suicide is just to really jump in there and actually ask the question very clearly and directly. So there are multiple ways to ask directly about suicide, but it's actually really critical that you're brave, you're clear and explicit as much as possible. The most important part, even if it stumbles out because it's not something you're used to doing, just if you can get it out there, then that is the most important thing, actually. So for example, are you having thoughts about suicide? Are you having thoughts about killing yourself? Skipping down a little bit. Have you ever wondered if life is worth living? Have you ever wanted to give your life away recently? Have you felt that others will be better off without you? Have you been thinking about making sure you never wake up again? So now if the person that you're supporting and you're reaching out to, or for the clinicians in the webinar community here, if you are clinicians and you're asking these questions as well, if the person says yes to having some of these thoughts, then especially if they're more in that category, like we talked about passive suicidal ideation, you want to follow up with the question of, are you thinking about killing yourself? So that you can get more specific. It's also just important to recognize, like I've been saying all along, to recognize that cultural kind of background and preferences affect how you ask, hopefully will affect how you ask the question. So not everyone may experience thoughts similarly. For example, the last few questions on this slide may pay attention to different ways that diverse individuals may prefer being asked about suicide. This second to the last one, have you wanted to give your life away? This was suggested to me by a colleague who works with Native American individuals a lot. And if for some reason, any range of reasons, you're not able to ask the question, so for example, sometimes, if the person in suicidal distress is someone who's really close to you, or for whatever reason you're not able to ask, please see if you can get someone else who can ask the question. So another person in their social support network. I've certainly been surprised when I ask the question, and there have been times that I wouldn't think that the answer would be yes, and sometimes it is still a yes answer. So on your worksheet on page 3, there are a few examples of pitfalls we want to avoid when asking the question. So one common pitfall is that we want to connect with our loved one, and we may assume that we know what's going on with them, in which case we might say something like, I know what you're going through, which can be isolating, especially if the person feels like you may not fully understand. So a more supportive way of asking is an open-ended question like, what are you going through right now? It's also easy to ask the suicide question in a way that gives clues about the answers you're hoping for, or in a way that puts words in their mouth. So 2 examples here. You're thinking about suicide, aren't you? Or you aren't thinking about suicide, are you? And that can really shut down talking. And it says that you're not really openly listening. So instead, we want to ask in an open-ended way and show them that you really want to hear what they have to say. So a really just simple open-ended question of, are you thinking about suicide? Finally, we may get frustrated at our loved ones for not doing more to help in their recovery. And your frustration may lead you to say something like, of course you're suicidal. That's what you get for not taking your meds. You're not even trying to work on this. And that certainly can have the effect of shutting down talking, and says that you don't want to listen. Instead, we might want to just kind of make sure that we know we're here for their safety, and say something like, what can we do to keep you safe right now in this moment? Now, in thinking about how to be sensitive and be brave while social distancing, I encourage you to think creatively about how to be sensitive and be brave. So, for example, are your loved ones more likely to feel comfortable and supported while they're not looking at someone face to face? So, if that's the case, maybe you send a text or use email or a phone call, that archaic phone call. Or are they more likely to talk openly with you if you could read their facial expressions? And if so, are you connecting better through facial expressions? If so, maybe a free Zoom account and a video chat would be good. Or in these times of social distancing, do you need to adapt by involving someone that they're sheltered with, for example? Are there ways that you can connect by showing them that you care with like a no contact delivery, for example? One of my dear friends gave a no contact delivery of ice cream the other day, just left it on our doorsteps and then texted us to let them know they're there. It lifted my kids' spirits for the entire day. Or a drive-by waving. Other tips for being sensitive and brave during COVID-19 may include kind of thinking about whether you can be sensitive on a regular basis. So this first line right here, knowing that they're going to talk to you once a week, for example, if you schedule a regular video chat, can give your friend or loved one a reason to get through the tough times. And this is actually mirrored on a standard of care that we use in the field, is that when someone's at heightened suicide risk, we schedule more regular check-ins, more frequent contact with providers. And so that's something that you can mirror as a community member to really have that regular check-in. Also, if your friend is sheltered with someone, do you have their contact information, the person that they're sheltered with? And if you don't have them and you know that they're in trouble, it might be a good time to just think ahead and get their contact information, just in case you might need to get in contact with their other supports if things get worse. Okay, so some examples of how to be sensitive and be brave. I want to emphasize that asking about suicide, it's a skill, just like driving, just like cooking or surgery. It takes practice. So I'll just really quickly model one example. So if you hear this example, and I'm one of your friends, and you hear that my husband has lost his job, I'm dealing with homeschooling 3 young kids at home, and my father recently passed away. When you text me to see how I am, I reply, "You don't want to know what's going through my head. I am so overwhelmed." So if you wanted to respond with a be sensitive and be brave effort, you might schedule a video chat, and after exchanging small talk on how things are going, you might say, "I'd really like to be there for you, and I really care about you. I know you have so much going on, and I want to make sure you're safe." So that's the be sensitive. Have you had thoughts of wondering whether life is worth living lately? Have you had thoughts of killing yourself? Be brave, right? So, and again, this is a truncated, a kind of a shortened example, but the 2 essential elements, the be sensitive and be brave, connect and ask. So we want to encourage you to practice being sensitive and be brave and asking about suicide. Here are some scenarios you can use to practice at home, really kind of brief scenarios. What you can do with someone on video chat or on the phone or whoever you're sheltered with. One of you can act as the person who's having troubles, and the other practice being sensitive and be brave as a helper. Again, have empathy for each other. This stuff, it won't come out naturally at first, but we certainly want to practice more and more. After you connect with the person, just be sure to practice actually asking the suicide question, and then switch roles so everybody can get practice. These scenarios are also on your worksheet. We just reviewed the second key step in being a helper, asking about suicide using the be sensitive and be brave approach. And so what comes next? Now we'll move on to safety. How can we do our part as helpers to keep our loved ones safe? So if someone says they're thinking about suicide, what comes next? We certainly don't want to leave them hanging. The next step is to do what we can to keep them safe and suggest that they get connected with the help that they may need. So there are 2 main parts to the step of keeping our loved ones safe. The first one is connecting them with help, and then the second one is increase their help connectors. I'll explain what I mean by help connectors in a bit. So first of all, I invite you to think about what the people in your community prefer in terms of seeking help. We know by research that help-seeking preferences go across the board. And the most important thing to know is what is their most comfortable or preferred place to get support. So some folks prefer going to their primary care doctor first, and then thinking about how they do that within social distancing. You know, the crisis hotline, a trusted adult. So oftentimes for adolescents or high school students, a trusted adult rather than their parents is a preferred source of help and feels a little more safe for the adolescent. And the important thing is that they get connected with somebody. Certainly it would be wonderful, speaking as a mental health provider myself, be great if everyone who's suicidal gets connected with a mental health professional. As therapists, mental health professionals are the ones who are specifically trained to deal with suicide. And so certainly if the person that you're supporting is willing to go see a mental health professional, you know, encourage that and reach out for help. However, that's not always the case. It's just important to recognize that people from different cultural backgrounds may have different preferences for help. And there are many different people and places that can help. So during COVID-19, we need to be aware that regular use of healthcare may be interrupted. For example, early on in the webinar, I showed you how many youth in Santa Clara County go to the ER for suicide attempts, and that, you know, folks may have some hesitancies about going to the ER during this time. Primary care for so many groups is a preferred method for help, and yet, you know, primary care tends to be a ghost town recently, but a lot of them are set up for telehealth, and so you know, those resources are out there. Also become aware yourself about the various telemental health resources that have become available. There are a lot of, speaking as a kind of professional in the field, there's been a huge effort amongst mental health professionals to convert to telemental health services. And from what I understand, you know, the connection through video chat and doing psychotherapy through video chat has been a really great replacement for in-person treatment. The Gronowski Center at Palo University is a training clinic that has a very low fee schedule for folks who don't have a lot of resources. Is a great place to go. Children's Health Council, I know, is also a great place that has gone online, and Community Health Awareness Council as well. So now I'm going to turn it over to Mego Lien, the Suicide Prevention Manager at Santa Clara County, to tell us a little bit more about resources, both locally and nationally.
Okay, great. Hi, everyone. So I will quickly talk about available resources. I recognize that there are people here who are from the county and probably outside of the county as well. So we've provided local and national versions of the resources as much as possible. We also recognize that there's a whole lot of resources out there and that it can be really confusing. And sometimes people need a resource just to figure out which is the right resource for them or for their loved one. So these here, these three numbers here that you see are pretty key numbers, and you can also access these numbers to ask about other resources that you might want to access. The first one is the National Suicide Prevention Lifeline, 1-800-273-TALK, 8255. This national hotline is linked to Santa Clara County's suicide and crisis hotline. So if you have an area code from Santa Clara County and you call the national number, this will link to the county number, and you'll have local county volunteers who are picking up the phone on the other end. The crisis text line is a national service as well. We have a Santa Clara County specific one. So if you text the word renew to the number 741-741, you will be connected. This is 24/7 also. You'll be connected to a trained crisis counselor that you can talk to via text message. So this is a really popular option. As Joyce mentioned, we've seen a big increase in the number of text conversations during the pandemic. The call center, the third number that you see down there, is specific to Santa Clara County. This is our mental health call center, and you can call that number, that 1-800 number. If you press 4, you'll be directed to a mental health clinician who will kind of do a quick assessment by phone. and do a referral to the appropriate county mental health service for your particular situation. So feel free to access those numbers. So here is a little bit more expanded version of the resources, again, divided by Santa Clara County and then their national versions. They're all 24/7 unless it's noted, and they also all have translation services unless noted. In the county, the mental health services are accessible regardless of somebody's immigration status and whether or not somebody has insurance. So again, the call center number is the first one that you see up there. When you call that 1-800 number, you will have an option for press five different numbers. If you press 1, you'll be directed to the Suicide and Crisis Hotline. Pressing 2 will get you to our adult mobile crisis team. And there's a number there too for mobile crisis, the mobile crisis option for youth 18 and under. We know people are trying to avoid going to the emergency room right now and going to the hospital because of COVID-19. The mobile crisis team is a team of mental health clinicians that will kind of do an assessment and come out to a site, whether a school or any community site, and do an assessment, de-escalation, and further referral if it's a mental health related crisis. So this is a good option right now. They're fully operational and an option for people in Santa Clara County. Number 3 will get you to urgent care for mental health, which is a walk-in clinic open every day from 8 a.m. to 10 p.m. We do recommend right now, they're fully operational, but if you are going to go in to call first and just ask, because they have changed their location slightly. So just to get clear directions about where to go if you want to access urgent care. And again, referrals and general information I had spoken about on the previous slide. Our county suicide and crisis hotline, if you want to call directly, that's the 855 number. And again, there's the national version to the right of it. And as I mentioned, connects back to the county number. The crisis text line, if you text renew, you will basically access the county, Santa Clara County version of the crisis text line. It's the same service, it's just a different way where the information goes. So nationally, you can text home to 741-741 and get the same service. Or in the Bay Area, you can text BAY, B-A-Y, to 741-741. Crisis text line is the one service that is available only in English right now and not in other languages. So you should be aware of that before you access it or give it out. For domestic violence hotlines in Santa Clara County, there's Next Door Solutions at this 408 number. It's a 24/7 domestic violence hotline. The people on the other end can speak to you about developing a safety plan and how you are going to remain safe for now if there is domestic violence going on where you are sheltered in place. And the national domestic violence hotline is over there on the right of the Next Door number. For reporting child abuse and neglect, the county's number is 1-833 SCC Kids, and they will follow the protocols for reporting child abuse and neglect. And then if it's really a life-threatening emergency and someone is in physical danger and you need to call 911, we do recommend that you ask, especially in Santa Clara County around the Bay Area, you ask for a crisis intervention trained officer. That's a CIT officer. These are police officers that have had at least 40 hours of mental health training. And so if you are experiencing a mental health related emergency, they would have some more training and information when they come and handle the situation. The last two, I think the bottom row might be cut off, but the websites there are for general information. All of these numbers are available on the Santa Clara County Behavioral Health website. And below that is the Santa Clara County Public Health Department's website for general information about coronavirus. So the link, if you can't see it, is secphd.org/coronavirus, or you can call the number 211 in the Bay Area to get more information. And I'll put that into the chat box in case people can't see that. So I'll hand it back to you now, Joyce, to finish up.
Okay, thank you, Mego. We do have just about a few minutes left, a few slides left before we'll go to Q&A. So one thing that I want to emphasize is, you know, when folks might say no to calling the hotline or the call center, just know that it's common for people to be hesitant about reaching out for help. If they hesitate, here are some options. Call the suicide hotline on their behalf with them there. You can help them out in doing that. You can get a verbal commitment from them to call the hotline later, or you can write down the hotline number and leave it with them via email or text. And it's also important to recognize that sometimes it can take a while or even multiple tries before someone decides to seek help. So if you do the Be Sensitive, Be Brave, you connect with someone and either, you know, the answer is no, you still are concerned, or they are not that receptive the first time to opening up the topic. Don't give up. Sometimes it just takes multiple tries as people are kind of adjusting to the idea of you being there to support them. It's not necessarily a one-time thing. So you can say something like, you know, again, on follow-up, I've been thinking about you. How have you been doing? I would love to check in on you. Did you get connected to blank? What has changed since we last talked? And also, if you see more warning signs or new warning signs, remember that you can always be sensitive and be brave and ask the question all over again, and then encourage that they connect to help. All right, we just reviewed the first part of the safety step. Now let's look at the second part, increasing help connectors. So what I mean by this is that your loved one is going to have the best chance of staying safe and feeling better if you're not the only one who knows that they're having a hard time. So we call this a safety net. So to really get through the crisis, even after the thoughts have passed, often the best thing we can do to support people is just to increase connections in their social network. So even if you think about it, makes sense, you won't be with your loved one all of the time. They'll benefit by having as many people as they're comfortable with as part of their safety net. And if they don't want that support person to know about their thoughts of suicide, you can also suggest, you know, we can still tell them that you're going through a hard time. And these help connectors can include the companion that they're sheltered in place with, their friends, family, doctors, you know, whoever you can think of, really. And again, this mirrors what we do in the field, which is when someone has suicide risk, we immediately try to increase the safety net by including every provider, family member, community member that we can think of, and that helps to keep them safe. So that concludes all three steps to the helping process in suicide prevention. Before we stop, I have one more note here, which is that you can't take care of someone else if you're not taking care of yourself. It's very much like the airbag on the airplane. Talking with someone about suicide, connecting them with help, it can be a stressful process. So don't forget to take time to recharge, take care of yourself, and just remember that self-care is not always self-indulgence. Taking that walk or eating a little extra chocolate can give you the energy needed to continue your role as a community helper. And remember that self-care is individualized, it's different for everyone. So for some of you, it might involve spirituality, active movement. For others of you, it might involve a long bath, simply enjoying the beautiful sky. I've got some Instacart coffee, ice cream coming my way in just a couple hours. And you know, that is my self-care for the day. And here's a resource from the American Foundation for Suicide Prevention during COVID-19. So some self-care strategies and some nice suggestions specific to social distancing, starting a gratitude journal, preparing your favorite food, making your space comfy and cozy. This one we forget, setting boundaries with your media consumption can also be important right now as there's so much news coming our way around COVID-19. All right, so to remind ourselves and conclude, this is what we did today. We defined suicide, reviewed suicide and COVID-19 statistics, reviewed common misunderstandings about suicide. We identified warning signs, including COVID-19 and cultural warning signs. We learned how to ask about help, particularly during social distancing, and we reviewed options for helping someone struggling with suicidal thoughts during COVID-19. So if you have any takeaways today, you may choose to remember these 3 messages: be sensitive, be brave, and connect people with help. And also remember the importance of the community eyes and ears. Please reach out to more of your connections more often as you have the time and the energy.